Get ready for these haunting photos which reveal the shocking treatment of mental health patients in the past, where cruelty and confusion defined their care. This photo shows a 21-year-old corporal who was shot in the head at the Battle of Farmville in 1865, shortly before the South surrendered in the Civil War. Years after he was discharged, his physician noted, "He has many symptoms of disturbance to the brain." These eerie photographs reveal the harsh realities faced by women diagnosed with hysteria in the 19th century, where symptoms like sexual desire and nervousness were deemed mental disorders. A new treatment with electroshocks which will produce new brain cells. Forgotten patients were left to sit around in the cold, sterile corridors of a U.S. mental hospital. Isolated and neglected, their faces reflect the despair of being abandoned. This haunting scene reveals the grim reality of mental health care in the 1940s, even after chaining was deemed inhumane for psychiatric patients. Restraints and other devices were used to protect patients from harming others or themselves. Today, few photographs exist of restraining tools, but this photo of a late 1840s Utica crib survived, an old medical device used to administer electric shocks to mental patients. The images depict women at the Salpêtrière Hospital in Paris during the 1870s, where medics attempted to diagnose and treat their disturbed states, often under the label of hysteria. Captured in an era of limited understanding of mental health, these photographs highlight the controversial treatments women endured in the pursuit of medical answers. A typical hallway to hell for psychical patients back in the days. Life inside a psychiatric hospital. 1938. Where nurses try to bring a hysterical woman to her room. Two men stare out of the windows in a stark hospital ward, their expressions reflecting a deep sense of isolation. The image highlights the emotional detachment and despair of life within the institution. It captures the quiet, haunting reality of their confinement. By the mid-1800s, Salpêtrière Hospital housed 5,000 women diagnosed with mental illnesses. Doctors at the time sought to understand and treat these conditions. The hospital became notorious for its treatment of women, often linked to misunderstood disorders. This 1885 photograph shows Billings photographing a skull that's submerged in a tank of water to measure its cranial capacity, which was thought to influence mental conditions. A photo of Teresa Samford, a mental patient from Oregon State Hospital, taken during a camping trip in 1972. The image captures her participation in an outdoor activity as part of a therapeutic program. The photograph was taken by Bill Epridge, documenting life at the hospital during a time of shifting mental health care practices. For centuries, women were diagnosed with hysteria for symptoms like shortness of breath or causing trouble. This broad and vague diagnosis led to harsh treatments. Women were often subjected to medical interventions based on societal misconceptions. For centuries, female hysteria was a common diagnosis, exclusively affecting women. It was believed to be caused by a displaced womb, with no regard for other medical conditions. This outdated belief led to treatments based on misconceptions of women's health. Women diagnosed with hysteria were often confined to asylums or subjected to surgical hysterectomies. This image captures one such patient undergoing treatment with hypnotism. This chair was used to control violent patients at the New York State Asylum in the early 20th century. An unruly patient's arms were strapped into the wooded wells, feet secured to the floor, and a belt tied around the boy. Sometimes a patient's head was covered with a hood. A woman diagnosed with delirium melancholy sits on her bed, embodying the isolation and confusion of 19th century psychiatric care. A patient being treated for hysteria undergoes a therapy session, showcasing the misunderstood diagnoses of the time. Women were often subjected to treatments like this for behaviors seen as disruptive. This image highlights the invasive and often ineffective methods used in 19th century psychiatry. Women sent to the hospital in Paris were sometimes treated with hypnotism as a means to calm their supposed hysteria. This image captures the unsettling methods used during the 19th century to treat women diagnosed with mental health disorders. Hypnotism was often seen as a cure for various female ailments. A patient diagnosed with hysteria lies in her hospital bed in the 1870s under the care of medical staff. This image reflects the harsh treatments and misconceptions women faced during this era, where mental health was often misinterpreted as a disorder tied to their gender. This photograph shows restraints that were deemed outmoded by New York State in the late 1930s. Iron handcuffs, muffs, wrist-body restraints, and ankle bands. Captured during her recovery from what was labeled an attack at the Salpêtrière Hospital in Paris in 1876, this image highlights the medical treatments women underwent for conditions often misunderstood at the time. This photo shows a man receiving static sparks to the spine for psychosis from tabes dorsalis, a degenerative nerve condition brought on by syphilis. Neurologist Jean-Marie Charcot Wright, who became head of Salpêtrière in 1862, along with his student Paul Regnard, captured portraits of numerous patients, documenting their conditions, including those diagnosed with hysteria. This medical documentation was a critical part of Charcot's controversial studies on mental health during the 19th century. The shower station inside the former Verdun Psychiatric Hospital. This photo shows a patient undergoing lateral cerebral diathermia treatment in the early 1920s. But doctors deemed it unsafe and unreliable. Charcot, a pioneering figure in the study of hysteria, documented his findings through photographs of female patients, which were later compiled into a book titled Iconographie photographique de la Salpêtrière. His work helped shape early neurological research, though it also fueled controversial perceptions of women's mental health during the 19th century. A patient hallucinates in her hospital bed, left, while another woman enters what was described as the ecstatic phase of a seizure, showcasing the extreme and often misunderstood symptoms of hysteria treatment during the 19th century. These dramatic depictions were part of early attempts to study and diagnose mental health conditions in women. The haunting images capture women undergoing treatment at the Salpêtrière Hospital in Paris during the 1870s, where they were diagnosed with hysteria and subjected to various treatments. These photos reflect the harsh and often misunderstood medical practices of the time. Charcot strongly opposed the belief that hysteria was a condition exclusive to women, challenging medical prejudice. He controversially employed hypnotism as both a diagnostic and treatment tool, as women in the hospital endured intense seizures and other disturbing symptoms. Women were frequently diagnosed with hysteria at the Salpêtrière Hospital in Paris during the 1870s, where they underwent various treatments, including hypnotism, for their distressing symptoms. Neurologist Jean-Marie Charcot documented his patients at the Salpêtrière Hospital, capturing haunting images of them before, during, and after suffering seizures as part of his studies on hysteria. Female patients at the pioneering Salpêtrière Hospital in Paris during the 1870s were admitted after exhibiting symptoms of hysteria, which included a range of physical and emotional disturbances. A female patient suffering from withdrawal buries her head in her hands, clearly overwhelmed by her condition. The image captures the intense emotional strain she is experiencing. Her isolation highlights the deep distress many patients faced during their treatment. A barefoot patient breaks away from the group in one of the communal rooms, symbolizing her struggle for autonomy. The image reflects the harsh environment of the hospital. It captures the tension between confinement and the desire for freedom. A patient engages in a finger painting activity, perhaps as a form of expression or therapy. The image captures a rare moment of creativity amidst the harsh environment. It offers a glimpse into the ways patients tried to reclaim some sense of autonomy. A man is confined in a straitjacket, standing alone in the stark, isolating environment of the hospital. The image evokes a sense of helplessness and the harsh methods used to control patients. It highlights the dehumanizing treatment many endured during their confinement. A female patient sits motionless on a bench, restrained in a straitjacket, highlighting the grim reality of her confinement. The image conveys a sense of abandonment and the inhumane practices of the time. It captures the vulnerability of those subjected to harsh treatment in mental hospitals. Nurses restrain a patient who is desperately trying to rise from her bed, showcasing the physical and emotional struggle. The image reflects the harsh methods used to control patients in these institutions. It highlights the dehumanizing treatment many endured during their time in the hospital. A man in a wheelchair gazes blankly out the window, disconnected from the world outside. The image captures the isolation and resignation experienced by many patients in the hospital. It reflects a sense of confinement and helplessness in their daily lives. Patients sit quietly around a table in the stark dining area of Cleveland State Hospital. The image captures the somber atmosphere where individuals often felt abandoned and disconnected from the outside world. The silence speaks to the grim reality of life within the hospital's walls in 1946. Men gaze out from behind the barred windows of the asylum, trapped in their confined reality. The stark contrast between the freedom outside and their imprisonment inside highlights the isolation they endured. The haunting image reflects the grim nature of institutional life during this time. The imposing structure of the Cleveland State Hospital stands tall, a grim reminder of its purpose. In 1946, it housed countless patients, many of whom faced harsh conditions. The architecture reflects the cold, institutional nature of mental health care during that era. A woman diagnosed with hysteria lies in her hospital bed at the Salpêtrière Asylum in 1876. Her expression captures the vulnerability and despair experienced by many patients of the time. Charcot's pioneering work on hysteria and his treatment methods, including hypnosis, shaped early psychiatric practices. A stark black and white portrait by Richard Avedon captures a patient in a mental institution, embodying the raw emotion and isolation of institutionalized life. The direct gaze of the subject emphasizes the haunting realities faced by those confined to psychiatric care. Avedon's photograph from 1963 speaks to the disquieting impact of mental illness and the dehumanizing environment of asylums. A haunting image of a patient inside an insane asylum, their vacant expression reflecting the trauma and isolation experienced in psychiatric care. The stark surroundings emphasize the sense of confinement, while the subject's gaze captures a moment of vulnerability and despair. This photograph sheds light on the harsh conditions faced by those institutionalized in mental hospitals. A disturbing image of a mental patient wearing a clown mask, highlighting the unsettling contrast between the facade of humor and the underlying pain of mental illness. The mask, symbolizing a forced disguise, obscures the true emotions and suffering of the individual. This photograph evokes a sense of discomfort, questioning the perception of identity and the complexities of mental health. Nerissa, born in 1919, and Catherine, born in 1926, were the daughters of John Bowes Lyon, the Queen Mother's older brother. Both women lived largely out of the public eye, with their lives shaped by the circumstances of their family. Despite their royal lineage, they were institutionalized for much of their lives due to mental health conditions. Harriet Jordan, an acute mania patient at Bethlehem Hospital, is depicted in a powerful image from the early stages of psychiatric care. The photo captures the harsh reality of the inhumane treatment endured by patients at the infamous institution. During this period, individuals like Jordan were often subjected to cruel methods with little understanding or compassion for their conditions. Frederick Truby King, the medical superintendent at Sea Cliff Lunatic Asylum, introduced the practice of photographing patients for clinical documentation. This practice quickly spread to other institutions as a way to visually document mental health conditions. The images offer a stark and unsettling view of how patients were treated and recorded during this era. These 1869 photos from the West Riding Pauper Lunatic Asylum capture patients in a time when mental health treatment was in its infancy. Despite the harsh conditions, the asylum later became a pioneer for more ethical approaches to mental illness. The images reflect a pivotal moment in the evolution of mental health care. The photographs, part of a vast collection by Sir James Crichton Browne, showcase patients under his care at the West Riding Asylum. As the chief neurologist, Crichton Browne played a key role in advancing the treatment of mental disorders. These images reflect both the medical practices of the time and his efforts to improve patient care. The image shows a woman diagnosed with senile dementia, seated quietly, while a man suffering from mania of suspicion gazes with intensity. Both patients are captured in a moment that reflects the harsh realities of their conditions. These portraits highlight the different mental disorders treated at the time. West Riding was one of the first institutions to offer more humane treatment for the mentally ill, a significant shift from previous practices. Before such institutions, patients were often confined to cells, displayed in bedlams, or restrained in workhouses. The asylum played a pivotal role in pioneering more ethical care for those with mental disorders. A woman diagnosed with simple mania sits in a stark room, reflecting the intense mental strain she endured. Beside her, another patient suffering from monomania of pride displays a detached and prideful demeanor. These images highlight the varying mental conditions treated at asylums during that era. West Riding initially began as a poorhouse for the mentally ill, but its success and progressive approach to treatment led it to attract paying residents. Over time, the institution became a model for ethical care of the mentally ill, drawing attention from across the country. The transformation of this asylum marked a significant shift in the treatment of mental health. A man diagnosed with organic dementia, left, sits solemnly, while a woman suffering from constructive dementia, right, displays a confused expression. Both patients are captured in a time when understanding of mental health conditions was still evolving. These images highlight the early efforts to document and treat mental illnesses. Sir Crichton Browne's pioneering research contributed significantly to the understanding of mental illness, proposing that some conditions were naturally occurring while others resulted from external influences. His work helped shape more compassionate and scientific approaches to mental health care. The photographs he collected remain an important historical record of psychiatric treatment. Men at West Riding Asylum are seen in these images, showing a more progressive approach to care. Patients were encouraged to engage in hobbies and could work in various on-site jobs. This was a shift from traditional, harsher methods of treatment. Joseph Parrish's photographs of inmates from the imbecile asylum capture the lives of those institutionalized in the 19th century. The images offer a rare glimpse into the conditions faced by patients during that time. These haunting portraits are a stark reminder of the past treatment of mental illness. The series captures a woman in a state of hysteria, caught in a seemingly endless cycle of yawning. These images were taken during a time when symptoms of hysteria were often misunderstood and misdiagnosed. The haunting portrayal reflects the dramatic treatments used to address mental health issues in the past. The image captures a woman during a hysteria attack, taken by medical photographer Albert Lond. It showcases the intense physical manifestation of the disorder, a stark representation of how hysteria was understood and documented in the late 19th century. Londe's photographs aim to document the clinical aspects of mental health, particularly in female patients. The image shows a woman suffering from catalepsy, a condition induced by hysteria, captured in a moment of prayer. Her stiff posture and fixed expression reflect the paralysis and unresponsiveness typical of this neurological disorder. This photograph highlights the severe physical symptoms of hysteria that were often misunderstood and stigmatized in the 19th century. This photograph from 1897 shows Beatrice Tetley diagnosed with melancholy at Wakefield Hospital. Her somber expression and passive demeanor capture the profound sadness and withdrawal often associated with this mental condition. The image reflects the early understanding of mental health, where such patients were often treated in institutional settings. This haunting image, taken between 1875 and 1885, depicts a patient diagnosed with melancholy. The somber expression and withdrawn posture highlight the deep despair and emotional detachment often linked to the condition. The photograph offers a glimpse into the treatment and perception of mental illness during this period. This photograph, taken in 1856, shows a patient diagnosed with religious melancholy. The individual's solemn expression and contemplative posture reflect the intense spiritual distress often associated with this condition. During the time, religious melancholy was often linked to deep feelings of guilt or fear of salvation, considered a form of mental illness. This 1850s or 1860s photo shows a patient suffering from suicidal melancholy. The expression captures the profound despair linked to the condition. At the time, patients like this were often institutionalized with limited treatment options. Circa 1850 to 1858, this photo depicts a patient at Surrey County Lunatic Asylum. Described as violent and dangerous, she was known for threatening harm to herself and others. At the time, patients like her were often subjected to harsh treatments. A woman suffering from cataplectic hysteria in the 1870s is captured in this photograph, exhibiting a state of paralysis and unconsciousness. These episodes were often linked to emotional disturbances, reflecting the intense and misunderstood conditions of the time. The image underscores the controversial treatments and diagnoses women endured during the era. This image depicts a male patient suffering from hysteria, a condition once thought to be exclusive to women. Male hysteria was often linked to emotional distress or psychological trauma, but the diagnosis was heavily stigmatized and misunderstood. The portrayal reflects the era's limited understanding of mental health. This image depicts a patient experiencing cataplectic hysteria in 1879, a condition causing sudden paralysis triggered by strong emotions. During this time, hysteria was often diagnosed based on physical symptoms linked to psychological distress. Such conditions were frequently photographed for medical documentation and study. Blepharospasme hystérique. Hysterical blepharospasm refers to involuntary eyelid spasms often linked to emotional distress. In 1889, hysteria was commonly associated with psychological factors manifesting as physical symptoms. This specific form of hysteria likely indicated a nervous or psychosomatic reaction during that era. A photo of Teresa Samford, a mental patient from Oregon State Hospital, taken during a camping trip in 1972. The image captures her participation in an outdoor activity as part of a therapeutic program. The photograph was taken by Bill Epridge, documenting life at the hospital during a time of shifting mental health care practices. The 1856 photo of William Sellers, taken at London's Bethlem Royal Hospital, Bedlam, shows a man being treated for mania after killing his mother. During this time, the hospital was known for its controversial treatments and public exhibitions of patients. The photo reflects the harsh and often exploitative conditions faced by individuals diagnosed with mental illness in the 19th century. The 1857 photo shows a woman diagnosed with apoplectic mania, characterized by sudden, impulsive behavior. She had been charged with infanticide, a serious crime often linked to mental illness in the 19th century. The image reflects the era's controversial views on mental health and the treatment of women in asylums. The 1856 photo of Charles Broadfoot Westrom, a murderer diagnosed with mania, was taken during his treatment at London's Bethlem Royal Hospital, Bedlam. In the 1800s, Bedlam became infamous for housing criminal patients, often under harsh conditions. This image captures the dark history of how mental illness and criminal behavior were treated during that time. The 1857 photo of a patient known only as HB shows an individual diagnosed with chronic mania. Taken by Henry Herring, this photograph is part of a series where doctors believed they could capture evidence of mental conditions through facial expressions. During this period, the link between physical appearance and mental illness was heavily studied, though the practice was controversial. The 1857 photo shows a male patient at Bedlam, posing while eating and drinking from a mug. This image, taken during a time when patients' behaviors were closely studied, reflects the hospital's efforts to document mental illness through photographs. The practice aimed to observe the physical manifestations of mental conditions, though it was controversial. The 1857 photo captures a woman seated calmly at Bedlam, wearing a bonnet. Bedlam, founded in 1247 during the reign of Henry III, was the first hospital in Europe to specialize in mental health treatment. Over the centuries, it became notorious for its controversial practices and treatment of patients, including public exhibitions. The 1857 photo shows a female patient at Bedlam holding a toy doll, possibly using it as a surrogate for a child or indicating a younger mental age. This image reflects the complex and often misunderstood nature of mental illness during the 19th century. Such photographs were used to study behavioral and psychological traits, though interpretations varied. The 1857 photo shows a woman at Bedlam with a nonplussed expression while reading. Her calm demeanor contrasts with the often chaotic environment of the institution. During this time, such images were used to document mental illness, though the motivations behind the patient's behaviors were often misunderstood. In this 1857 photo, a female patient at Bethlehem Hospital holds a box of thread, indicating that sewing was an encouraged activity. Despite the harsh reputation, historians suggest conditions at Bedlam were similar to those of a typical Victorian home. Patients were often allowed to walk freely around the grounds. These two well-dressed male patients were photographed by Henry Herring to analyze their conditions through facial expressions. During this period, Bedlam was located in St. George's Fields, Southwark, now home to the Imperial War Museum. By 1930, Bedlam moved to Bromley and is now a leading psychiatric hospital run by the NHS. These two female patients, photographed in 1857, are dressed similarly in bonnets and dresses, typical of the time. In the mid-1800s, Bedlam became a tourist attraction for the wealthy, who could pay a shilling to walk around and observe the patients, akin to visiting a zoo. This practice reflects the exploitative nature of mental health care during that period. This black and white photograph from 1926 shows the exterior of Bethlehem Royal Hospital in London, located at St. George's Fields in Southwark. At the time, Bedlam had recently moved to this site, which is now the location of the Imperial War Museum. The hospital continued to serve as a psychiatric institution until its later move to Bromley.